I'm Ryan Brown. I am the Director of Physical Therapy here at Maine Health Orthopedics and Sports Medicine. I am actually one of few fellowship-trained orthopedic physical therapists in the state of Maine. And I've been with Maine Health for 4 years, and I worked for another entity for 12 years prior to that. So I've graduated in 2005, and I've been treating rotator cuff patients since then. I've kind of taken a specialty in the overhead athlete, so I see a lot of rotator cuff injuries in a year. I think over the years, and we've even seen drastic changes with the amount of time that patients are immobilized after rotator cuff surgeries. I mean, it's gone from 6 to 8 weeks down to 6, down to some of the more progressive ones at 4 weeks. Probably within our office now, in physical therapy, 25 to 30. I'm seeing some within a week to a week and a half after surgery coming in with minimal to no pain and no sling, which is mind-boggling, and oftentimes have to check to see if there's any portals or anything that they actually had a surgery. The reduction in pain in the early range of motion, I think, saves those people, because I think when they went from the, say, 6 to 8 week sling time, those patients are staying immobilized, they are not using their arm at all, and they're coming out stiff. So you spend the next 6 to 8 weeks fighting them, versus day one, we're progressing them from within their tolerance, and that's the amazing piece. And you kind of, the first few that I saw, you're pushing it and like, all right, you sure you don't have pain here? No, you can keep going. You're progressing through the full range of motion almost day one. Yeah, I don't think there's maybe one out of the thousands of rotator cuff repairs that I've treated previous to this model that had full range of motion that quick. And I mean, just even referring to like the last 4 to 6, all had full range of motion within that first month, which we weren't even touching the patient prior to that first month. They're taking minimal to no pain medications. I think the majority that I've seen have thrown more pain medication in the trash than they have taken, so that's a great thing. People are getting back to their lives much quicker. So we weren't seeing patients upwards till the 6 week mark in physical therapy. Now we're seeing them within 1 to 2 weeks, and these people are pretty much back to normal lives within that 4 to 6 weeks, instead of just starting the physical therapy program, which is huge for patients. Especially the revisions are, I would say they're more pissed that this wasn't around the first time around, because they're like, I'm back quicker, my pain is less. It's just changing the way, and it's changing the way we're also helping to steer patients. Like I said, it's a very blue-collared state. And to give the patient the confidence and show them, like, we've been video recording kind of all these patients coming in and their standards, and patients are very surgery, I don't know, I can't be out of work for this. But when I show somebody, you know, consecutive videos of different patients with full range of motion at 2 weeks, the product kind of speaks for itself. Probably my most recent case of a gentleman who came in at a week and a half with full range of motion on that, and then I followed back up with him in a week, so at 2.5 weeks. After checking everything, he's like, no, I'm fine, no pain, full range of motion. Obviously strength was a little bit lacking, but he had no issues with that. He'll even comment on this point that this revolutionized things, because he goes, you know, I was 4 or 5 months into rehab before I was doing any of these things before. Now you take a revision, which is more difficult, and he's back within a month. There's so many patients that we manage that have partial tears, medium thickness tears, that are just trying to keep their business going, but they're trying to manage their pain at the same time. And those are the patients that we're almost pushing to our surgeons now and saying, hey, just get this fixed. You're going to be done faster. It's going to be stronger after, and you'll be back to work quick. You're not taking much time off. Seeing all the overhead athletes that I've treated over the years that hem and haw and sit there and say, I don't know, I got 1 season left, and let me see if I can string it along and deal with this pain and stuff. I don't think it will just revolutionize the rotator cuff world. I think it's going to revolutionize the tissue. So from Achilles tendon repairs, different glute repairs, it's just tissue's tissue. This is going to be a game changer, I think, across the body.